This is a very difficult question. We don't yet have any answers. Much of this has to do with general level of anxiety in the young population about world situation. They're worried about meaninglessness of their existence. There's certainly a considerable amount of depression among youngsters, among adolescents, and so they may be using drugs in order to, as a form of self-medication. They may be using it as a form of escape. They may be using them as a form of rebellion. Some may be using these LSD type of drugs as a way of looking in to explore the inner psyche. In a way, it is a valid assumption, but the method is extremely dangerous. The main dangers of the strong hallucinogens like LSD, mescaline, and psilocybin are psychological. And these drugs may precipitate psychosis or insanity, which may be brief, but which unfortunately may be lasting or lifelong in some people. So the result of the drug usage really depends on the underlying personality. Somebody who is already borderline or somebody who is pre-psychotic is much more at risk, of course. The other factor to be considered is under what conditions the drug is taken. In some settings, in a supportive setting, at home, in a non-threatening atmosphere, the danger of a paranoid panic, for instance, is far less than if the drug is taken by oneself, and also when one is worried about being found out, being caught. So the primary dangers of LSD group of drugs are psychological. You can precipitate schizophrenia-like breakdown.
As an expert in the field of drugs, why are we having so much emphasis, or why are so many young people